On behalf of the entire second decade team, ladies, gentlemen, sharks, thanks for this time with you. As you heard, I'm with the Office of the Assistant Secretary for Health, and part of our mission is to coordinate prevention activities across all of HHS and indeed across the country. And in that spirit, let me introduce you to three 10-year-old children, Jenny in Cincinnati, Nick in Seattle, and Pamela in San Diego. Now, the leaders in these three communities have each undertaken initiatives related to a particular aspect of adolescent health. In Cincinnati, it's bullying. In Seattle, it's obesity prevention. And in San Diego, they're focusing on drug abuse after several teenage overdose deaths. Let's suppose for the moment that these are uniformly successful, and that's terrific, such that Jenny, for example, never experienced bullying in high school. Unfortunately, like many of us, Jenny developed fairly unhealthy eating habits and a sedentary lifestyle such that at age 20, she is now seriously overweight and in fact has been diagnosed with prediabetes. Nick didn't develop obesity thanks to that initiative. Unfortunately, Nick succumbed to the lures of tobacco advertising and is now seriously addicted to smoking. Pamela didn't use drugs. Unfortunately, Pamela engaged in unprotected sex, became pregnant, and without adequate support in place, dropped out of high school with all of what that means for her future. These stories illustrate the problem, and that is this, that analogous to the toddler years, the second decade of life is an incredibly important period when many health-promoting or health-damaging behaviors become established. And yet, few, if any, American communities are doing all of what we know we can do to promote healthy development among adolescents. To be sure, we have terrific guidance. I need to be clear about this. For all of these things you see listed here, we've got comprehensive tobacco prevention, school health, school diet, activity, smoking, suicide prevention, a variety of other things. That's not the problem. There's stacks of these comprehensive guides specific to specific topics. The challenge is this. Somehow, as a community leader, take all of these comprehensive guides and integrate this into some kind of framework that allows you to build your community so it's adolescent healthy. That's the challenge we set out to attack. Now, our initial idea was to take this large stack of specific guides, represented here by Tolstoy's War and Peace, and somehow get to a diamond-hard Cliff's Notes version that just had the key essential recommendations for each of those specific things in one place that these leaders could go to. Our target user has always been the idea of a community leader, a champion who cared about adolescent health, who could assemble a broad coalition across the entire community sector in a community that was ready to really start building toward an adolescent-friendly community. We conducted many interviews, over 30 interviews, many with leaders, but also with parents, with teachers, and a variety of others. And through these interviews, this is what we heard. Whatever guidance we come up with has to be able to help a community get started. There has to be some guidance to pull this thing together. It's got to be simple. In fact, it can't be too simple. And it's got to be action-oriented and lead them through like a recipe. It's got to include multi-impact measures so that doing a single thing could impact multiple events like smoking, like teen pregnancy, like obesity. Because it shouldn't be a long list. As people said, we can't possibly do everything and implement every program. Therefore, we ditched the idea of this diamond density Cliff's Notes version and went instead to the idea of a planning guide, focusing on the needs that we'd identified through these interviews. The planning guide is essentially a framework for how to pull this all together. Let me describe that framework to you. It begins with the foundation, the champion and the coalition I mentioned before, and their job is to pull together a shared vision of where they want to go as a community, to develop a long-range plan with short-range steps as well, and ultimately some assessment metrics too to measure how they go. Their first step in putting this plan together is to select from a list, a relatively short list, of powerful multi-impact health measures like school-based health centers that can impact many aspects of an adolescent's life and several others that you see listed there, changes to the built environment, increased engagement of parents with their adolescents and so forth. This is a key part of this framework. But in addition, we have to remember there are going to be specific things unique to each of these challenges, smoking, teen pregnancy, and so forth, that can't be addressed in these cross-cutting approaches. And it'll be up to this coalition to select from those to make sure that they're doing all they can in some of these very high-impact health issues. This is the framework for community action that we developed. This is what we're calling the second decade prevention architecture, and this is our solution to the integrated framework. Quickly, I'm going to show you that for smoking, nothing changes in the foundation. That's part of the power of this. There are things that could be done in each of these cross-cutting things related to smoking, such as referral for cessation services from a school-based health center. And for smoking specifically, though, there would be special things like advocating for cessation services and availability in your community, or even advocating for tobacco-free college campuses. So in looking at that, that's how it would relate to smoking, and there'd be many other issues addressed as well. Our goal is that instead of doing one thing, this process would be used to drive a much broader approach to community health, and that by 20 years of age, we'd have healthy children who grew up properly with every opportunity to become healthy. Let me close with where we are, what we need. We've been fortunate to get some funds to actually evaluate this prototype. We're still being told even our next generation, second-gen prototype is too complex and too wordy. What we need now, and we need it right away, is a technical writer and a graphic designer to help get this into place in time for the evaluation and take it to the next stage. Thank you very much for your time.
Wanda, should we start with you?
Thank you, Patrick. Lots of questions here, but I like the way this has been tremendously simplified, the vision simplified through this process. It doesn't mean there's not dimensionality. I'm reminded of two other similar sorts of frameworks and efforts, and want to know among the linkages, not just on the siloed health topics, but we have Bright Futures for Children that HRSA pioneered that may, I don't remember if it runs up through the teen years, and then the social determinants framework that Healthy People follows. So where would you see this sort of integrating and building on lessons learned and perhaps leveraging assets that might have grown out of Healthy People efforts, out of HRSA's efforts with Bright Futures?
So thanks very much for that. To take the second point first, we were very influenced by Bright Futures, and well, I should say particularly influenced by the social determinants of health model. That's really implicit in a lot of what we did without calling it out for those names. And there have been a number of other efforts made, like Bright Futures, that do impact. So we've been informed by that, we looked at that, tried to incorporate that thinking. Whether this could be brought under that umbrella or just be influenced by to learn from its lessons is something we've still got to figure out.
I really like this project. I think you did a great job synthesizing this for us, and the ask is very appropriate for the goals that you want to achieve. I don't think you're overkilling it with like, oh, there must be a technology solution, there must be some other thing. You just kind of found the simple solution that you need here, and that's the only ask, and I think that's really important for a lot of these projects. So yeah, congratulations. I think this is a really good job.
I was wondering if adding to what Mark said, you could add certain requirements to your ask or add certain line items which would allow you to prototype this in a more immersive way with a community or a team or many teams that are in the process of implementing something like this or are thinking through that. So, and you might need resources such as, design researchers and people who understand how teams form and teams communicate with each other. And I'm wondering if you've given something like that thought, because you might end up, discarding some of your assumptions and sort of coming up with more as you go through that process.
Well, that's an excellent suggestion. We've been sort of trying to take this a step at a time. The evaluation funds we have in hand is going to give us a chance to see if what we come up with at least is usable, we'll get some good feedback on how it might be changed, and can it be used by some key communities who are already motivated to move forward and get to a plan. If we assume for the moment that is generally positive, with some tweaks we'll learn from that, to be honest, our next goal will be to find some funds to actually pilot this with communities for whom this is brand new, not with whom we've already been working, to see whether it works. That would require a good deal more money. Not a fortune, though. I want to stress that there's plenty of funds in this field. There's funds for smoking prevention, there's grants for teen pregnancy prevention, and so forth. What's missing is the framework to pull it together. Nevertheless, some piloting funds, some initial startup incentive funds would help communities pull this together, and so we might be going for further funds if we can show this is working. Thank you.
Yeah, I just, more of a comment than anything else, but I think the realization and focus on simplicity is really an important one. I think we see far too often big programs get developed because that's what we do. We develop programs and we write things and we're good at that. We're often not very good at sort of paring down the words or making things easy to follow or easy to implement. And I think that's a really interesting key learning that you guys got out of your interview. So I think that's fantastic. I think we're out of time here unless you guys have any other questions. No? All right. Thank you very much.